And so my project is to improve the communication between the providers at our hospital at Cheshire Medical Center, Dartmouth Hitchcock Keene, and my tobacco treatment program so that people can get the treatment that they need in order to stop smoking. I'm Kate McNally, and I am in the Healthcare Administration program at Marlborough Graduate School. And my capstone project is to integrate tobacco treatment in the clinical setting, and I'm focusing primarily on family practice or family medicine and women's health. And the reason that I'm doing this project is because there's a lack of referrals from our clinical setting to my tobacco treatment program, and we wanted to increase those, largely because we've kind of stalled as a nation in our tobacco use rates, and they're not as low as we'd like them to be. And we know because of the public health practice guidelines, public health clinical practice guidelines, that we can double the rates of tobacco cessation by having brief interventions with patients and by referring them for treatment. The surprise is that this is a big systems change, and that there's a lot of education that needs to happen. And I really needed to put my project management skills into use, and I needed to also work on some conflict resolution skills that I learned while I was here at Marlborough Graduate School. And I was really surprised that, that more people wouldn't just, climb on board. And the reason why is because there are so many competing issues out there right now. We have healthcare right now is being faced with a lot of changes, and there's a lot of demands on time and energy. And so it's been a process, and it's taken a lot longer than I had hoped. So I kind of had my own timeline for getting the work done, and what I've learned is that I've got to be patient, and I've learned that patience, and I've learned how to work through the process because of the guidance that I've had here.